Okay, welcome back. We are going to be viewing rinse back or reinfusion of the patient's blood after dialysis treatment is over. Okay, so you could see at the top of the machine, it says RTD is 0. That means remaining time of dialysis is 0. And it's also on the machine right there. Okay, so now the technician will clear the alarm and the blood flow rate will be decreased to 200 milliliters per minute in anticipation for the rinse back. Okay, so now the technician will stop the blood pump and we're going to have, the technician is going to rinse back the arterial by gravity. So he unclamps the wide clamp and he removes the scissor clamp, and the arterial is going to be rinsed back by gravity. If the access has a strong pressure in there, you might need to squeeze the bag a little, just gently apply a little pressure so that the patient's blood will go back into their circulation. So we're looking for a light pink. So once we get a light pink on that arterial line, the technician will clamp the small clamp on the cannulation line and also the big clamp on the arterial blood line. Now our technician is going to switch the clamp to the bottom of the T, and we're going to start our pump to rinse back the rest of the arterial blood line, venous blood line, and the dialyzer. So as we rinse back, we're looking for a light pink. If the lines are too clear or too white, it means that you've given your patient too much fluid. Now, when you rinse back the patient, before you remove the needles, you want to get a blood pressure because you need to know if you need to give the patient additional fluid. So you complete your rinse back and then you want to take a blood pressure to make sure that you don't need to give the patient any extra fluid. Okay, so as you can see, your machine the pump is going at 200 mLs per minute, and we're waiting for the patient to be rinsed back or blood to be reinfused, and we're looking for a light pink on the venous line, blood line also. Okay, so as you can see, we're getting there. And we're just waiting for the patient to be rinsed back. Okay, so this patient has a fistula. And so we're rinsing back the blood into the fistula. Okay, so now we have an equal color, right? So we know that we've achieved the rinse back goal, so we're going to now clamp the venous line and we're going to clamp the venous blood line, and our rinse back is completed. Thanks for watching. Don't forget to like and subscribe to Dialysis Training Institute of Excellence. We're located at 831 Merrick Road, Baldwin, New York. Telephone number 516-705-4637.